So we now all know that in order to assess what your health is truly like, we need to go and get tested, whether that be a physical examination or a blood test. So in this video, I thought I would go through a few blood tests that I would advise anyone to get this year if they were looking to have a greater insight into their health, what the levels mean, how to interpret them, and then also what are the benefits of knowing this with regards to optimization of your health. So before we get into it, I just said here that when it comes to blood testing, many people wait until they're about 40 years old. Now, I don't think they wait until they're 40 years old. I just feel as though a lot of people do not present towards a medical setting until this age, because beforehand, a lot of people are generally quite healthy. So what I want to try and do or advise is that people start this journey as early on as they can, because knowing your results early on in life gives you greater amounts of data to then set your baseline, your trend lines, and that is the most important thing when it comes to your health. In what direction are you going? Are you improving or are you declining? But the first test that I want to go on to is something called LP(a), so lipoprotein(a). And when it comes to this, you may be familiar with something called LDL cholesterol. And this is a test that you can get on many health panels through the National Health Service, and it's probably available within the US as well. LDL cholesterol is a subset of your lipid panel, and it basically measures the amount of particles that tend to go away from the liver and go towards the arteries. And LP(a) is a further subset of LDL cholesterol. This extra molecule attached to the LDL cholesterol, which increases your risk of heart attacks, strokes, aortic stenosis. So when it comes to getting it tested, why should you get it checked if it is just a subset of LDL cholesterol? Surely that would cover it within that test. But the answer is it doesn't, because it is not testing for that subset level. And you can have normal levels of LDL cholesterol, and you could be at really high risk of having the complications I've just went to, because structurally and in function, these little molecules can cause havoc. They carry more oxidized particles. They increase the likelihood of you forming a clot. You need to know what proportion of this subset is comprised of LP(a). What I've done below here is put the ranges of where it should be. So 0 to 75 nanomoles per litre is what we would consider low risk. Then 75 to 125 is what we would consider intermediate, and greater than 125 nanomoles per litre is high risk, and that is of heart attack, strokes, aortic stenosis. And the benefit of getting LPA tested is that from the age of 2, you fully express levels of LPA within your body, and through other processes which I will come on to in future videos, you can't really change that level going forward. So the level that you get tested at any one point in your life is likely to stay consistently that level for the remainder of your life. So that's why it's got a high return on investment. It's why it's number 1 on my list, because 1, it gives you great insight as to whether you have a high likelihood of having a heart attack, but then also if you have it once, you don't really need to repeat it. So financially, it's really good. As I've said, these are the complications, but how easy is it to get this test? Now, this doesn't normally form a standard blood panel. So within the UK, you cannot go into your GP and request an LP(a) blood test. Normally, this is only reserved for specialist clinics who think that their patients would benefit. And in my opinion, everyone would benefit from knowing their level. Within the US, I think it's a bit different in the sense that you can request certain blood panels, and I think it's the same within Canada too. In the UK, for example, it is always best to go to a private clinic. Obviously, my company that we've set up, if you're UK based, will do at-home blood testing for LP(a), and this is not a plug, it's just to show you where you can go to get these things. There's no point in me telling you to go and get a certain blood test or advise it and then not give you the means to do so. So yeah, we offer that also. The second one, which you may be familiar with, is something called HbA1c. So basically, this is assessing the amount of sugar that is attached to your red blood cells, and it allows us to see what your control has been like in terms of blood sugar for the past 3 to 4 months. But what is the importance of knowing what your blood sugar control has been over this period of time? And the importance lies in the fact that we are able to see how efficient your body is at using insulin, at storing glucose, and it gives us some insight into how insulin resistant you are, what likelihood you have of developing type 2 diabetes. So that is where it comes in. However, there are some drawbacks to HbA1 testing, and the reason being is that the result normally tells you what's happened as a consequence of something that's maybe happened for years. So to explain, I wanted to show you this graph here. So this is a bell-shaped curve, and if you think about this as the level of insulin within your body. So as sugar rises in the blood, so does insulin, and people are aware of that. So the more sugar we have, the more insulin is produced, until the sugar levels normalize, and then insulin will go back to normal, which you can see clearly within this bell-shaped curve here. However, if you become more insulin resistant, which is outside the scope of this video, your body overrides this by producing more insulin. So this bell-shaped curve would get higher and higher, and it would correlate with the same level of blood sugar on a test, which you can see within this diagram here is that for a set duration of time, it doesn't really change. However, there comes a point where we have released so much insulin that your body is unable to produce any more, which would be shown here on the decline of the bell-shaped curve. But the graph below shows that glucose is going up because we do not have the effects of insulin present within our body. So this is happening on average 10 to 20 years before insulin resistance fully develops on any other blood test, before type 2 diabetes normally manifests. And the reason I brought it up here is that if you were to check your HbA1c during this interval, it probably wouldn't show up as too much. However, at the very end, once you've developed full-blown insulin resistance or you've got a lack of insulin within the body, then it would show up on a HbA1 test and your result would be high, and I will come on to the ranges in a minute. But the reason why I still include it is that it still gives you an idea of your metabolic health, but you need to take it with a pinch of salt in the sense that it may not be showing you the full picture. But with regards to ranges, 20 to 41 millimoles per mole is considered normal. 42 to 47 millimoles per mole is termed as something called pre-diabetic. I would take that as a point of you need to start acting because there's a good chance that you are showing signs of insulin resistance here. And this is where your body has been overproducing insulin to produce the same response in regards to your blood sugar control. And then greater than 48 millimoles per mole is classed as diabetic. Obviously with this one, you would be trying to go for the 20 to 41 range, but one reason why you would get this tested is to see in what trend your body is going. So if it goes from 20 to 25, then something is going on within your body. Yes, you are still normal, but there is something that is forcing you to have a higher blood glucose control. With regards to this one, how easy is it to get tested? Well, you can go and get it on the average health panel. So if you go to the NHS and ask for some form of diabetic test, this would be available. There is no specialist division required for this test. And if you are going to see whether your results improve, because it's based on red blood cells, I would wait 3 to 4 months before repeating a test. Before that, the results are probably not going to change too much, and there's not much you can actually take away from the results. What are the benefits to knowing this biomarker? So insulin resistance here. What is the likelihood of you developing type 2 diabetes mainly? Then if you develop insulin resistance and type 2 diabetes, you are increasing your risk anyway of having heart attacks, strokes, eye disorders, kidney disease. These are all through the manifestations of insulin resistance, but you can see by knowing your metabolic profile, or at least knowing the trends, then you can start to act on it. And there are many ways you can act upon HbA1c. I will do a further video discussing the ways that you can optimize this level, but just note that this is something that you can influence in a large majority of cases. Now, the last one is something that has only really come into my thoughts probably over the last 6 to 12 months, and it's the omega-3 index. And omega-3, for anyone who doesn't know, is an essential fat, meaning that we cannot make it within the body. We need to obtain it from our diet. And like I've just put here, we get a lot of nutrients from our diet. Why have I focused on this one? Why have I not focused on vitamin D, calcium, etc.? And it's because a lot of diets severely lack omega-3, and there's about 80% of the population that are actually deficient, or they are not optimized within their omega-3 index. And there has been evidence that lower levels are linked to chronic inflammation, a buzzword of the moment, and there are many consequences of being chronically low-grade inflamed. Within this same panel, we also measure comparison between omega-3 and omega-6, because then that sort of gives you a predisposition as to whether the body is within an inflamed state or within an anti-inflammatory state. However, one thing I would love for you to take away from this is that by having a low omega-3 index or having a disproportionate omega-6 to omega-3 ratio does not mean you are chronically inflamed. There are other tests that we do to support this. However, having a low omega-3 or a disproportionate omega-6 to omega-3 ratio does not mean that you are actively undergoing inflammation. It just means that you are more likely to do so if anything were to go wrong. And this is a massive misconception. A lot of people are missold on this. They are missold down the line of supplements, and I completely disagree with it, because I have done tests myself, high sensitivity CRP, ESR, all these other inflammatory markers which do not correlate with my low omega-3 index or disproportionate omega-6 to omega-3 ratio. Now, talking about levels, what should you be aiming for? So this is relating to omega-3 index. Less than 4% showing that the population were at high risk of cardiovascular disease. So that meaning anything related to the heart and arteries of the body. So heart attack, stroke, peripheral vascular disease, etc. 4 to 8% meant that these were at moderate to intermediate risk, and 8 to 12% is where the optimal range lies. As I said before, risks associated with a disproportionate omega-3 to 6 ratio or low omega-3 index are heart disease, chronic low-grade inflammation. Inflammation is a very, very big buzzword at the moment, but we shouldn't be too negative on it. Without inflammation, we wouldn't be able to survive as a species. So we need to have it, but we need to be able to control it and make sure that it's not chronically elevated, which is where the issue lies. As a result of having inflammation or having all these other issues, you will have musculoskeletal issues, and you can have cognitive decline when you have a lower omega-3 index. It does form a lot of the neuronal structures, cell membranes, so we need to optimize that going forward. With regards to where can you get omega-3 index checked, you can do that through ourselves again. I wouldn't offer this video if I didn't have a solution. There are other clinics that do it, but in terms of where you're able to get it on a National Health Service screen, I haven't actually seen it. I work within clinical practice, for anyone who doesn't know, and I don't think I've been able to click omega-3 as a testing profile. But the reason why I've included this above high sensitivity CRP in this video is the fact that a lot of people will not be actively inflamed, especially within the 20s and 30s from my experience. But if you have low omega-3 indexes, then you are having a higher predisposition towards that. So it's allowing you to then correct this, stop you having chronic low-grade inflammation. And the text ends here with, I do have more tests that I would include this year if you were looking to optimize your health, but some of them didn't make the video. So depending on how this video does in terms of feedback, I will then release another video on other tests that I have personally taken and that I would personally recommend to people so that they can get the most out of their health journey this year. But I'm not only just doing a video on what tests and what they mean, but also, like I've said before, I am going to include videos on how to optimize LP(a), how to optimize HbA1c, how to optimize omega-3 index. A disclaimer as always, and this one is probably more relevant, this is not medical advice, and you should always seek that from your local registered medical professional. If you've got this far, thanks for watching. If you have any ideas about videos, then by all means comment below or message me directly, and thanks for watching.